everyone. As you know, my name is Hannah Evans, and I am the Communications Manager here at Population Connection. So thank you very much for joining our last course for August, where we've been looking at the different sort of connections between population and climate change. And today we're going to be looking at the implications for reproductive health care to act as a solution for both sustainable development, but most importantly to climate change. So we've covered a lot of information over the past 3 weeks. And again, we've been using the overarching theme of population and climate change to explore the implications of global population growth as it relates to the already existing and ever imminent threats posed by a warming planet. So in week 1, we discussed the ways in which population growth contributes to climate change, both in terms of increased emissions over time, which is measured in reference to the large-scale demographic shifts, which will drastically increase the global population, as well as living standards for the vast majority of people on the planet. And we've also looked at population in terms of climate vulnerability, which is used to describe the overall capacity to recover from climate impacts measured at all levels of society. And we've done this in an attempt to clarify the dangers associated with the simultaneous growth of the human population, especially in low resource settings, and the compounding severity of climate-related weather events. And ultimately, for how complex climate change is already in ecological terms, it is also very deeply rooted in societal inequality and systemic injustices. To say that the populations who are the least vulnerable for the climate crisis are also the most vulnerable and least resilient to extreme and unpredictable weather patterns, rising sea levels, and temperature increases, all associated with global warming. So framing climate change as an ethical and political issue affords the transparency and nuance necessary to form solutions that will be successful and scalable. Situating climate change within the context of human rights and social justice is absolutely foundational to combating climate change and should be led by grassroots efforts and through the reintegration of Native and Indigenous knowledges into environmentalist platforms, as well as social and economic structures within societies. And last week, we looked at some of the ecological effects of human activities within the context of zoonotic disease emergences like COVID-19. And we used several different case studies to better understand the implications of conventional processes like industrialized agriculture, growth-based economies that favor overproduction, and the consumption of fossil fuels in terms of increasing the likelihood of future pandemics and decreasing the health and well-being of both Earth and of humanity. And so in order to prevent the next zoonotic outbreak, it's integral that we reduce our impact on plants, animals, and the living environment. We also need to develop a deeper understanding of the interconnections between human health and ecosystem health that can be incorporated into our societal structures. And so emanating from those discussions, we're going to talk today about the potential benefits associated with increasing access to reproductive health care globally. And we'll argue that access to voluntary family planning is not only a universal human right, but also an environmental imperative. And for those of you who were able to join during the first presentation, you might remember this slide, which I used to talk about PHE, or Population Health and Environment approaches to development, and our focus as an organization on integrated solutions that simultaneously address social, economic, and environmental issues. And now that we've discussed the social and environmental implications of population growth, we'll look today at the health portion of the concept and focus on the benefits that reproductive health care have both in immediate timeframes and over the long term. It's important to understand that population dynamics, and in particular population trends, high fertility, and family planning, all play a role in climate change adaptation, or the capacity for a state or a country to respond to and recover from climate impacts, both institutionally and ecologically. Rapid population growth and high fertility work to compound the threats posed by climate change, especially in low resource settings. High levels of unmet family planning needs also contribute to the existing population pressures, like resource depletion, strains on economic growth, limits in access to resources like education and healthcare, the status of women, which aside from being a human rights violation is also an inhibitor to economic growth and sustainable development, if it must be viewed in those terms, and also overall health at the individual, community, and state levels. So worldwide, again, the same regions that experience high fertility, low economic status, and high climate vulnerability also have a high unmet need for contraceptives and reproductive healthcare services. An unmet need for family planning in these regions increases vulnerability and inhibits the ability of individuals, households, and communities to adapt. In recognition of these interconnected issues that magnify new and existing inequalities, there should be a greater attention paid to the effectiveness of meeting the unmet need for family planning services in terms of helping to create resilience and increase adaptive capacity, both in general and especially for the world's most at-risk regions. Family planning has long been identified as an integral part of global sustainable development strategies, but we need also to be working to recognize comprehensive reproductive health care more broadly as a human rights-based and cost-effective approach to addressing climate change. Remember, the world's 47 least developed countries are also the fastest growing. According to the UN, the total population of Sub-Saharan Africa is expected to double by 2050, resulting in a 99% increase from 2019. Many countries in Sub-Saharan Africa, such as the Democratic Republic of the Congo and South Sudan, are experiencing some of the world's fastest population growth rates while also being among the most vulnerable to climate change. And as we spoke about in the first class, 9 out of the 10 most climate vulnerable countries are in Sub-Saharan Africa, which again is projected to double by 2050. And while we've been talking a little bit about the reluctance to integrate population into environmental agendas, I think it's worth noting that the IPCC, or the Intergovernmental Panel on Climate Change, has identified population growth as a factor that increases climate vulnerability and has stated that meeting the need for family planning services in areas with both high fertility and high vulnerability can actually reduce human suffering as climate change carries on. And actually, an example they use and have used to provide context is the Sahel region of Sub-Saharan Africa, which is also a region we've talked a lot about. Largely, I think, because it represents one of the most pressing humanitarian crises on the planet right now. And again, the Sahel region is experiencing temperature increases that are 1.5 times that of the global average. And collectively as a region, it has the highest population growth rates in the entire world. So in coming decades, the region's population will grow from 100 million in 2010 to 240 million by 2050. Other studies have just recently been published showing that that people in the Sahel were already using 41% of the available carbon in the landscape in 2010, which is more than double the 19% used in 2000. So as the population continues to accelerate, food insecurity combined with limited arable lands and decrease in crop yields due to temperature increases will mean that there will be a lot of very, very hungry people. And affected countries are acutely aware of these interconnected issues and have publicized the very real threats posed by population pressures as they relate, of course, to sustainable development, but also to climate change. So the UN has developed a framework for less developed countries to use to identify the main drivers of climate vulnerability within their respective countries. And they've done this with the intention of organizing and prioritizing particular actions that respond to a country's most urgent and immediate needs. So these plans are called National Adaptation Programs of Action, or NAPAs. And the reason I bring this up is because out of the first 40 NAPA submissions, 37 of the world's least developed countries that will be the worst affected by climate change have highlighted rapid population growth as a factor that exacerbates the impacts of climate change. That means that 93% identified at least one of 3 ways in which demographic trends interact with climate impacts. 1, by increasing degradation of natural resources at a faster pace. 2, through increased demand for scarce resources. And 3, through heightened human vulnerability to extreme weather events. So these findings certainly suggest that family planning services should be made more available for communities most at risk. Yet only 6 countries identified investing in family planning as a priority to address that challenge, and none of the NAPAs have directed investments in family planning. So in an analysis done by the World Watch Institute and Population Reference Bureau, which looked at the evidence linking population dynamics and climate compatible development, researchers found that reducing unintended pregnancies would result in many different health, educational, and economic benefits for women and their households. And they also concluded that these benefits could also reduce human vulnerability to climate change impacts. So from there, they've made recommendations for increasing the financing available for both climate change and family planning, but importantly for the inclusion of family planning and funding platforms designed to help countries prepare for and respond to climate change. So increasing access to family planning services benefits climate adaptation in several ways, but first and foremost by increasing the health and well-being of women and children. Healthier populations, of course, have a better chance of withstanding and recovering from climate impacts. Adaptation is also built by helping to empower women through reproductive autonomy, which opens up possibilities for engaging in climate adaptation efforts, and by reducing unintended pregnancies. This results in smaller families and a smaller demand for resources like food and water. Finally, slowing population growth lessens local environmental pressures and exposes fewer people to climate impacts. And just quickly to review, access to sexual and reproductive health care can influence population dynamics through voluntary fertility reductions and lower infant and maternal mortality rates. Additionally, comprehensive reproductive health care increases the health, welfare, and life expectancy of women and children. It advances individual rights, reduces poverty, and slows population growth. Together, these benefits help to strengthen environmental sustainability and state stability. And coupled very essentially with family planning services is education. So it's common to see the two grouped together because they clearly complement each other, but also because they sort of co-constitute one another. In other words, increasing access to family planning services cannot be viewed in isolation, as it's almost always not the be-all end-all solution. It's just as important that women, girls, boys, and men have access to education because, among many other things, it very fundamentally facilitates independent and even critical thought, which is essential for breaking down cultural barriers or belief systems that may otherwise prohibit the utilization of such an advantageous resource like family planning. Additionally, when education levels rise for women and girls in particular, they gain social, political, and economic power. Higher levels of education afford more options for sustained employment and helps increase livelihoods. Given this information, it's no surprise that women who are educated tend statistically to have fewer, healthier children. Expanding access to education is incredibly important for any society, but is particularly a vital component for sustainable development in low resource settings, which already face the biggest structural barriers both to getting an education and to family planning services. And in terms of climate change mitigation, increasing access to reproductive health and education has the potential to be extremely impactful. While investments in smaller families hold many instant social benefits, their impact on carbon emissions is not nearly as immediate. However, over the long term, slowing population growth has the potential to outperform anything else. So on this slide, you'll see the top 5 solutions to climate change put forth by Project Drawdown, which is a nonprofit dedicated to producing research on the potential effectiveness of climate interventions in certain spaces. And they've argued that health and education could result in emissions reductions of up to 85 gigatons of CO2 by 2050, which is equivalent to removing over 22,000 coal-fired power plants. So Project Drawdown publishes ongoing research which ranks solutions in terms of their projected emissions impacts globally. And they do this based on different scenarios in order to assess what determined global efforts might actually look like. So this table depicts scenario 1, which is roughly in line with the 2 degrees Celsius temperature rise by 2100. So if we're going to meet those standards, these are the most advantageous solutions. And as you can see by looking at this chart, health and education is actually ranked second out of 82 different global solutions. This means that its potential impact on global emissions in the long term and its cost effectiveness are among the most compelling of all. Additionally, family planning helps foster stronger economies, which is another really important part of climate resilience and adaptation. So the lifetime opportunity costs of adolescent pregnancy in general, which is a measure of the annual income adolescent mothers forego over their lifetime, because instead of going to get an education and participating in the economy, they're having children at younger and younger ages. The opportunity costs range from 1% of annual gross domestic product in a large country like China, but up to 30% of annual GDP in a smaller economy like that of Uganda. So investing in family planning is incredibly important for virtually all aspects of society, and for sustainable development more broadly. And as you can see here, this is just a sort of picture looking at the implications of family planning impacts for meeting sustainable development goals set forth by the UN for 2030. And so that's our focus. We work to ensure everyone everywhere has access to the full spectrum of reproductive health care, including vital family planning services. And despite impressive progress over the past several decades, there are still over 218 million women in what are called LMICs. LMIC is an acronym that stands for low to middle income countries, who want to avoid pregnancy but are not using a modern form of contraception. In these countries, 49% of pregnancies are unintended, which totals to 111 million unintended pregnancies annually. In contrast, if all women in these countries who wanted to avoid pregnancy were to use modern contraceptives, and if all pregnant women and their newborns were to receive care at the standards recommended by the World Health Organization, the impacts would be enormous. So there would be a 68% decrease in unintended pregnancies, a 72% drop in unsafe abortions, and a 62% reduction in maternal deaths. So focusing on reproductive health is extremely important in general, but it's also very critically at this particular point in time, as COVID-19 has drastically impacted access to these essential healthcare services throughout most of the world, including the United States. In fact, estimates are now showing that millions of women and girls globally have lost access to contraceptives and abortion services because of the coronavirus pandemic. Due in large part to resources being redirected to address the virus, many women are now unable to seek safe abortions because they could not find care in time, and also because lockdown procedures have ebbed and flowed for months now. Mary Stropes International recently reported that across 37 countries, nearly 2 million fewer women received services between January and June than in the same period last year. 1.3 million of those are in India alone, which has been particularly hit hard. The report by Mary Stropes projects that there will be about 900,000 unintended pregnancies worldwide as a result, along with 1.5 million unsafe abortions and more than 3,000 maternal deaths. And unfortunately, these numbers will likely expand if services become more limited in the regions of Latin America, Africa, and Asia. The World Health Organization said that 2/3 of the 103 countries surveyed over the past few months have experienced disruptions in family planning services, which is a figure that's been used by the UN Population Fund to predict that there could be up to 7 million unintended pregnancies worldwide as a consequence of limited healthcare services brought about by COVID-19. So no access to healthcare has forced many to seek abortions in unsafe and incredibly dangerous conditions, and has also caused a surge in teen pregnancies in some cases, and also child marriage. So currently, family planning programs receive just 1% of all overseas development assistance. Fully meeting the current unmet need for family planning services would cost $12.1 billion annually. Even with investments from donors, governments, and corporations, there's still a $5.5 billion funding gap for meeting the unmet need for family planning services. So the US is consistently the single largest contributor of global health aid. However, funding for family planning programs is constantly under threat. So for one, the US hasn't funded the UNFPA for the 3rd year in a row. And the global gag rule, which was reinstated and expanded in 2017, greatly limits aid to all global health programs. This policy was supposedly designed as a way to stop funding abortions overseas and to reduce the overall numbers of abortions in general. But unfortunately, it's proven to be wildly ineffective. Firstly, because the United States never actually funds abortions directly, because we've made it illegal to do so. And secondly, because the policy does not actually limit or reduce the number of overall abortions. Instead, it increases the rate of unintended pregnancies and then the likelihood that women will seek abortions. Except now they're occurring in unsafe, life-threatening conditions. Wow, I went through that really quickly. So we're gonna open it up for questions after this, but I wanted to conclude with a few points about the talk today. So the first is that expanding access to family planning and reproductive health is most essentially about human rights and empowerment, with indirect but crucial benefits to the environment. Family planning is also a fundamental building block of climate resilience and adaptation strategies that should be incorporated into climate action plans across the world. However, with a $5.5 billion funding gap, fully meeting the unmet need for contraceptives urgently signals a greater need for investment now more than ever. So, all right, we can open it up for questions.
Thank you, Hannah. That was excellent. We've only gotten a couple of questions so far, so I'll ask those. My camera, sorry. While we wait for other questions to come in. So first, we have how much awareness of their looming challenges and suffering do these countries, leaders, and people have?
Yeah, that's a good question, and something that I wonder if I could go back. Oh. Trying to go back here. So affected countries are, again, acutely aware of these issues and have even identified rapid population growth as being an inhibitor to sustainable development, but also something that is worsening the impacts of climate change. So National Adaptation Programs of Action, or NAPAs, have been created by the UN as a way for countries to assess their vulnerability to climate change and to identify the most urgent needs of a country in order to adapt properly to climate impacts. And again, the 37 of the 40 submissions at first included rapid population growth as an inhibitor. They're also looking at things like soil degradation, freshwater scarcity, migration, deforestation, and other human impacts on the environment that are sort of driving and fueling the climate crisis, just in local terms. So I think that there's a really heightened awareness of all of this, especially as climate impacts are starting to hit sooner and faster than was earlier projected. But there's just sort of a lack of cohesion, I think, at the global international level in terms of how best to approach climate solutions.
So somebody is asking, Hannah, would you please elaborate on your last point? Are you saying that lack of funding for family planning globally is the main obstacle?
The main obstacle to what?
Achieving climate stability?
Oh,
I'm going to guess on that person's behalf.
Well, so our organization, a lot of what we do is just education and outreach about the connections between global population growth, access to healthcare, and environmental sustainability. And our sort of niche is to look at these integrated solutions, one of them being family planning that addresses social, environmental, and economic issues within societies, and that facilitates sustainable development. So recognizing that family planning funding and increasing funding in order to meet the unmet need globally has both social and environmental and even also economic benefits is something that we want to be highlighting, right? Because it's not something that I think is well known enough. To say that it's like the most important solution to climate change is an oversimplification. Climate change is a really complex issue, and there are many different solutions that need to be put forth and emphasized, and all of this needs to be happening now. But one really important solution is to increase access to family planning.
Yep. Somebody's asking, how much would eliminating all unwanted pregnancies decrease population growth? And I don't know if there's an answer to this, so I'll let you say what you think, and then I'll chime in, but I'm not sure there is an answer.
Yeah, it's a good question. So just meeting the unmet need for family planning, what would the implications be in terms of the future population?
Yeah, I guess so. Like, how many fewer births would there be per year?
Well, in terms of environmental impact, that's a really difficult thing to measure because, ecological impact is, and resource use is, it varies widely throughout the world. I think that as we kind of have been talking about over the past couple sessions, population momentum and like young populations who are reaching reproductive age right now will contribute to population growth into 2050. That's already certain, even with massive sort of improvements in access to family planning right now. And that likely will continue, I think, into 2100. Mary, you might want to correct me there.
That's as far out as the projections go, but yeah.
But I mean, if to give some context, if everybody were to adopt replacement level fertility right now, everyone in the world, which of course is not possible, but the implications of that into 2100 would mean that we would have 4 billion people on the planet by 2100, and we have 7.8 now. The UN currently projects that we're going to have about 11.2 billion people. So the implications over the long term in terms of reducing population growth and increasing just sustainable development and natural resource use are really significant, especially when viewed again in the long term. So I think it's one of the most important ways forward collectively.
Yeah. The one thing I'll say about that is about that question is that the Guttmacher Institute, which is where we get a lot of our data and statistics from, they estimate that the current US contribution to international family planning programs, which is $607.5 million, that prevents 4.54 million unintended births each year. And that if we were to increase our investment in international family planning to $1 billion a year, which has been the request of health coalitions for many years now, we would be able to avert 7.6 million unwanted births each year. So that's just considering the US contribution to international family planning. So it can make a pretty big difference. Somebody asks, what can the average person, other than voting, canvassing, and lobbying, do to get the Helms Amendment and global gag rule revoked?
Well, the advocacy you're already doing is a really good start. I think that, it's all about kind of education and outreach, and you're already very politically active, it sounds like, calling your politicians, understanding who's in opposition to the Helms Amendment versus who's for it. Voting in favor of reproductive justice and access is, of course, paramount. And I think also in terms of kind of shifting the sort of political conversation, unfortunately, I think that like things are most effectively portrayed if put in like economic terms. So if we're able to kind of convey how cost-effective family planning is in terms of return on investment, and the sort of implications for long-term sustainability in quantitative terms, I think that that's probably one of the most efficacious ways forward. Again, unfortunately, it has to be put in those terms, but I think that that's another impactful solution.
Mm-hmm. And we actually, for the first time ever, have a piece of legislation right now in the House called the Abortion is Healthcare Everywhere Act to overturn the Helms Amendment. So that has never been the case before. This is the first time. So you can contact your members of Congress in the House of Representatives and ask them to support that bill. Somebody actually who used to be on our staff here says, are there tools for teaching others to use your slides to give similar talks?
Well, the slides are available online, and for the ones that I've put forth as resources for this climate change project, I purposely put a lot of text on the slides so that it wouldn't be too difficult to kind of, develop a comprehensive presentation without notes. But if you're interested in getting more information, or if you'd like to ask me anything about how I approach things, you can feel free to reach out to me. I don't have any instructionals right now. We do
during the before times anyway, before we had a pandemic that prevented us from going out and doing in-person, gatherings and presentations, we had a membership relations department that worked with members of Population Connection and training them to be spokespeople for us. And we do have resources, presentations, and info sheets and things like that to hand out, doing tabling and festivals and things like that. But obviously that's all kind of on hiatus for now. But once the pandemic lifts and we're able to go out and do things like that again, you can get in touch with the membership department, membership relations department at engage@populationconnection.org. Somebody's saying, is it possible to get Hannah's script from each presentation? Yes, that will all be, well, not the script, it's not like a transcription, but the slides and the video will be on the website.
Yes.
Can the correlation between China's strict population control efforts and its huge improvement in standard of living serve as a worldwide example?
Oh, is that it?
Yes, that's it. I
yeah.
had two questions right next to each other.
Oh, no, that's right. Sounded like you were going to say something else.
I know.
Can it be used as an example for increases in standards of living? Well, China's one-child policy is an example of something that we would never under any circumstance advocate for, because it represents the coercive control of population through measures that aren't voluntary. And I think that, historically, we've seen time and time again that coercive policies, aimed at controlling certain populations, or the population in general, end up, having these very sort of xenophobic, racist, classist, sexist undertones, inevitably. And it's just never something that we would want to put forward as an example of anything positive. I think that China's own evolution, sort of economically, has just kind of contributed to increases in standards of living, but I think that overall, it's still a very authoritarian sort of quasi-communist country. So,
yeah,
no.
What she said. Can you point to good resources on the role of family planning vis-a-vis ethics and climate change? Do you have any resources you'd recommend? Those are probably on the website too, some of them anyway.
Yeah, we have a few on the website, and I think organizations like Population Reference Bureau has come out with a couple of really good resources on climate adaptation and the links between that and family planning. Other organizations like the International Planned Parenthood Fund have also come out with kind of papers and action statements, like clearly linking the connections between population or family planning, and climate change adaptation. Even organizations like Women Deliver have also come out with articles and sort of publications about these links as well.
Okay, we'll do one more and then we're going to open it up to people to network with each other if they so choose. So last question, how can we be more supportive of women who elect to live child-free, avoiding the shaming associated with this lifestyle choice or selfish?
Yeah, that's a really, really great question. And again, a lot of our focus on these presentations has been international, but You know, that's not to say that population issues aren't also relevant in the United States in places where, you know, replacement level fertility is already in effect. And I think that, yeah, I think shifting the sort of cultural, socially constructed understandings of what it means to be a woman or, you know, have a family, or, you know, the importance of all of that within a society is, you know, it should shift. It should be recognized as something that might have held some historical significance, but that is not relevant at all anymore. So I don't know, Marian, I think that, I know you're really passionate about this, if you want to chime in here.
Yeah, no, I think your answer is great.